Hi all. So this week it is chapter 6, which talks about technology for patient care, and what has the federal government done to enhance quality of patient care through use of health IT. And Hitech Act. So this is basically components of the act. It talks about the incentives that EHR. If you're in a hospital, or if you're a clinic, if you're basically a care provider who sees Medicare and Medicaid patients. Like I said, Medicare patients are those above the age of 65, and Medicaid are people with a certain income level that qualifies them for the program. Now, so if you're a clinic or a hospital that is seeing Medicare and Medicaid patients, you will be reimbursed for those patients' fee by CMS, or Center for Medicare and Medicaid Services. Now, one of the things that hospitals and clinics don't want to do is to have a large population of Medicare and Medicaid, because it's a very long-drawn process to get the reimbursement from the Center for Medicare and Medicaid Services. So encourage that, and to detract hospitals, or rather care providers, from not seeing Medicare and Medicaid patients, the federal government said, okay, let's incentivize this. Okay, if you see more Medicare and Medicaid patients, or a certain number of Medicare and Medicaid patients, we will give you funding to implement technology, to implement EHR, to implement healthcare technology in your clinic or your hospital. So that's one of the things that that this chapter talks about. Of course, not in very detail, just a little bit. Then the Hitech Act, which is the Health Information Technology, Economic and Clinical Health Act, established Medicare and Medicaid EHR incentives, established 62 regional extension centers, created health IT workforce, and also outlined the infrastructure for HIE, or Health Information Exchange, which is basically so when we talk about health information exchange, let's look at a very simple example. So let's say you go to visit with a hospital or a doctor in Beaumont, and they have your personal health information, or EHR, stored in their database. Now, this information needs to be, let's say you relocate to Virginia, or you relocate to Virginia, or let's say Louisiana. So in order to share that information that is in the Beaumont Hospital with the Virginia Hospital or Louisiana, there has to be some network to exchange that information, so the information to be carried from one place to the other. And HIEs, or health information exchanges, are exactly that. They are basically networks, or computer networks, if you will, that allow exchange of information between different organizations in different states and different cities and all that. So one of the things that Hitech Act did was to emphasize the establishment of HIEs, or health information exchange infrastructure nationwide. Okay. Overview of the Hitech Act. So if you can read this. Goals of the Hitech: to improve individual population health outcomes, increase transparency and efficiency, and improve ability to study and improve delivery of care. Now, if you are a healthcare provider that is basically sees patients that are Medicare and Medicaid, part of the Medicare and Medicaid program, you get these certain incentives. Okay, so for example, you can maximum incentive for eligible professionals is 44,000, 10% bonus for health professionals shortage area. Then for Medicaid, maximum incentive for eligible professionals is 63,000. So this much how much you will get from federal government if you implement EHR. To be eligible, you must be certified EHR in a meaningful way. You use EHR, submit reports to the Center for Medicare and Medicaid Services, and so on. Remember, we talked about meaningful use, basically, right? Okay, you have technology, you are using this for patient care. However, is there empirical validation, or is there empirical proof to suggest that this certain technology, whether it's an mHealth app, or whether it's EHR, or whether it's remote telemedicine, is this really beneficial for the patient? Is there empirical validation? Is there empirical evidence? Okay. Now, there are certain aspects that you have to remember. Is when we talk about the federal government, of course, there are federal government agencies that are basically that are overseeing care providers, whether you're a hospital, whether you're a clinic, and it's not a very easy task for the federal government to make sure that all their efforts are directed appropriately to the right entities. So in order to do that, they follow a certain process, they follow a certain strategic map. Now, all of you know that the Affordable Care Act, or some people like to call it the Obamacare, came into existence in 2010, and it mandated a lot of things. Mandates health insurance for everyone in the United States, expands Medicaid to those up to 133% of federal poverty level, introduces HIEs or health insurance exchanges, and prohibits placement of lifetime limits and coverage for pre-existing conditions, and the Center for Medicare and Medicaid establishes innovation centers. So these were the initiatives, some of the initiatives of the Affordable Care Act. Okay, and then you read about ACOs. Now, accountable care organizations. So once the Affordable Care Act came into existence, they wanted accountability in healthcare. Now, what that means simply is that, look, if you are caring for patients, you're Medicare and Medicaid patients, and you're funded by the government, you're being reimbursed by the government, by the CMS, which is a part of the federal government, you have to make sure that the quality of care that you're providing to these patients are top notch. Okay. So in that sense, you have these are what the federal government likes to call it accountable care organizations. Organizations who are in healthcare, they are accountable to the federal government. So for example, one of the accountability standards that was set aside was that if a patient was, just as an example, if a patient was going into a hospital, a Medicare and Medicaid patient for heart surgery, and if the patient had to be admitted within 30 days period from the day that patient was released, that hospital that performed the surgery, the heart surgery on that patient, would not be reimbursed the costs of the patient fees for the surgery and post-surgery care, etc., etc. That was one of the conditions. So what happened was, when you're putting these conditions in there, then hospitals, care providers become quality conscious. I mean, these are checks and balances. They say, okay, you know what? We better up our standards. Not that they were not doing, but there have to be checks and balances, because the federal government said, look, we're going to give you money, at the same time, if you let you go free, I mean, it's not going to work, right? I mean, some people are going to take advantage of it. So they put in checks and balances, and that's what these ACOs are, right? They are accountable to the federal government. So also with these, recently with the advancement of technology and what I like to call it the pervasiveness of technology in the healthcare industry, there are a lot of things that are coming out in terms of even you as a patient or consumer of healthcare are able to make payments very simply. Okay, so bundle payments option, pay for performance, shared saving programs, and all that. It said health information exchange is essential to new models of care and payment, electronic movement of health-related information among organizations according to nationally recognized standards. Promotes improved patient care, quality, and safety. HI benefits, makes relevant health information readily available, provides means to reduce duplication of services, provides governance and management over data, facilitates achievement of meaningful use. So this is basically, this chapter talks about the technology regulated by the federal government, specifically designed to take care of patients. Okay, so let's look at the articles that you have been assigned for this week. So this is, although this is not directly related to what we talked about, but however, the whole idea of meaningful use stems from the fact that, okay, are you using the technology in the right way, and is there empirical validation? So most physicians were eligible for federal incentives to them, but few had EHR systems that met meaningful use criteria. So this is one of the things that was happening. Okay, so if I'm a clinic, I go into EHR, I use EHR, but not the way that I'm supposed to be using, in terms of, is it improving my patient outcomes? Is it increasing quality of care? So if you look at this chapter, it's this article is a very simple read. It's a very short study. And the discussion says, in 2011, an estimated 91% of the office-based physicians are eligible to apply for financial incentives under Medicare and Medicaid. Regardless of the eligibility, only 51% of the physicians intended to apply. Only 11% of them reported both intending to apply and having the computerized capabilities to support the 10 of the 15 Stage 1 core objectives that the Center for Medicare and Medicaid Services requires. So this is again meaningful use standards that are set by the CMS. So they're telling, okay, you're a doctor, you're a clinic, you're a care provider, we've given you the funding, you've implemented EHR. Are you doing it in the right way? Okay, you've taken our money, but however, have you put that money to good use, and that money does it have direct impact on patient outcomes? And this is the study, and I'm telling you, this is one of the most interesting studies. It'll give you a sense of what meaningful use is. It'll give you a sense of how the federal government basically directs its efforts. Okay, they're giving you an incentive, but they want to see results, right? So these are checks and balances, right? Now, one of the things that you'll notice is a 2011 paper. Obviously, now in 2015, things are improving. More and more doctors have been advised how to use EHR to maximize benefits for their patients. And this meaningful use criteria, they're understanding, they have a better perception about this meaningful use criteria. So that, obviously, it's a win-win situation for everyone, for the doctor, for the patient, for the CMS, or the federal government, for their efforts. Okay, so things have improved, as we are talking about, but I just want to give you a sense of how much focus there is on meaningful use criteria. Okay, so with that, let's go on to meaningful use itself. This is an article, again, a short read. Electronic health record systems and intent to apply for meaningful use incentive programs. Key findings, if you look at the key findings, 2050% of office-based physicians use electronic medical records, with use by state ranging from 40% in Louisiana to 84% in North Dakota. About 1/3 of them reported having system that met the criteria for basic system. So this gives you a sense of, even with technology, I mean, like we were saying in the earlier weeks, even with technology, if the technology is not properly utilized, it doesn't serve the purpose of the user, which is essentially, we're talking about the care provider here, the doctor, the physician, and even the patient. It's not going to work, right? So obviously you have to figure out ways for this technology to work for everyone. And of course, when you say everyone, the most important entity here in this whole healthcare industry is the patient, right? We're doing everything for the patient to make sure that America's health improves. Okay, we want to reduce the healthcare costs. I mean, it runs into $2.3 trillion of taxpayer money. That's a lot of money. Okay. So we want to reduce that. We want to reduce the cost. We want to improve patient care. We are the most expensive in terms of healthcare. However, we are ranked 18th in the world in terms of quality. Why is that? Why is there such a large disparity? That needs to be fixed. Okay. Now, last but not the least article, it talks about the HIE. So it gives you a sense of what HIEs are, and it defines HIEs. And I would like you to read to get a better understanding what HIEs are and how they are basically allowing information exchange, health information exchange. What are the issues? What are the benefits? Why the HIE adoption has been slow? What are the main reasons? What are basically the main challenges of having HIEs? Okay. So with that said, good luck with this chapter, and thank you.